guys, it's Dr. Fine. Today we're going to be doing one of my favorite treatments, a Fraxel Dual, which is good for so many things. Today I'm going to be treating a patient who has some mild discoloration and mild scarring from previous acne, also has a little very mild sun damage, some freckling and brown spots. And Fraxel can target all of this. And what the Dual does essentially is use two different wavelengths of energy that both target deeper into the skin, which is going to help with collagen stimulation, but also more superficial, which is what really will focus on clearing up sun damage, brown spots, more superficial lines. So it's a treatment that can really do a lot of things at once. There's a little bit of downtime, but really not much. Immediately after the treatment, you can be red like a sunburn, but by the next day, that's pretty much gone. And then you're left with about 2 to 5 days of some kind of rough texture, feels kind of like sandpapery or some flaking. And within a week or even a little bit less, back to normal. So let's get started. How's it feel?
I don't feel anything.
Numbing work.
Yeah.
So yeah, we just use topical anesthesia prior to this procedure for about 45 minutes to an hour.
This isn't bad at all.
We want to get all this brown up here. You know, everyone gets a little bit of this at the end of the summer, even with deep bath sun protection. So the skin is reacting just like I would expect. You get a little bit of that redness, pink immediately. But he's doing great. He's not feeling anything. And then we go over the area about 6 to 8 times, but depending on the energy wavelength we're using. So one thing I like to do immediately post Fraxel to help with cooling down the skin is to apply a calming sheet mask. So we're going to put that on now. This is one by Ben. A little gooey. That should feel nice and calming. You get a little facial massage too.
Ooh.
Okay, and I'll let this sit about 3 to 5 minutes, and then we'll put on some elastin nectar, and that's what I like him to use for the next week when he's healing. Applying it to the skin twice a day, along with just a very gentle cleanser. I do think that the elastin nectar cuts down on the healing time in about 1 to 2 days, and I do think that it really enhances the outcome of the treatment. So I highly recommend anyone getting a Fraxel to be using the nectar along both before and after the treatment.
I'm feeling good. Feels like I have a mild sunburn, but I still feel a little numb from the topical numbing, but the treatment, super easy, not bad at all. But yeah, feel great. Happy I did it.
He did great. He was a model patient, and he looks exactly how I would expect him to look. That, you know, nice and pink, which will be down by tomorrow. Today is the only day that he's going to kind of look and feel like a sunburn is the best way to describe it. And then aftercare for the rest of today, I don't, other than putting the nectar on, you don't have to wash. You could apply extra moisturizer if you feel like you need to over the next few days. If you feel a little tight, you can moisturize in addition to the nectar, and then just use a gentle cleanser. Fraxel is such a great treatment to think about doing at the end of the summer and the fall, after you've been in the sun for months. Even with the best sun protection, most everyone gets a little bit of freckling, brown spots. So this is a treatment that really all skin types can benefit from. My patients in their 20s and 30s, it's a great cleanup for, again, sun damage, discoloration from acne, and texture.